started doing monthly, low-cost and subsidized vaccine clinics for pets in March of 2021. We were in the middle of all of the pandemic chaos. We had folks calling us, telling us that they lost their jobs, they've lost their homes, and they also have pets at the same time that they are trying to provide for and care for and hopefully avoid surrendering.
We wanted to remove any barriers to being able to ensure that the pets in this community have access to care that keeps them safe and healthy.
The benefits of vaccinating your pet every year are just to help protect them from diseases that can be deadly, such as panleuk, calicivirus, parvo, and they're totally preventable if you vaccinate regularly. So it's great that we're able to offer that.
Lawrence Humane is so lucky to have all of these incredible partners in the community. We partner with Just Food and Family Promise, Bert Nash, Senior Resource Center, and a lot of these organizations, they're the ones already serving people in the community who have the different needs that we would like to help with. And instead of reinventing the wheel, we would much prefer to partner with those agencies. So starting in March of 2021, we started doing monthly vaccine clinics. And then this past spring, March was the first ever National Vaccinate Your Pet Month. And so we decided, instead of doing one clinic that month, that we wanted to do one a week. We asked Just Food, Senior Resource Center, and Bert Nash to join us in this and to advertise these clinics to the folks that they support. And we were also incredibly fortunate to have a lot of fiscal support. So we had donors that sponsored specific clinics. We also had incredible donations from Petco Love, who provided one of the vaccines for cats and one of the vaccines for dogs at no cost to us so that we could provide it at no cost to the pet owners.
We are so grateful for community partnerships that have helped us grow this program. One of the things that's so important to us is that we're reaching the people who need us the most. And so many of our community partners have helped us access to those individuals who really need these services and maybe haven't necessarily been following the Lawrence Humane Society.
Pets in need are a very special part of our Hills mission, so we try to help them as much as we can, and Lawrence Humane is just the ideal partner to do that with.
When animal shelters are invested in the community, we are looking at animal issues holistically. So it's not just about the animals that are coming into the shelter that need a new home, but also how do we keep animals in the home that they have? And one of the issues that we see is that sometimes people have trouble affording to keep their pet when significant health issues come up. And so if we are able to invest in helping provide preventative vet care, that means that those are animals that don't come through our doors because their families are in medical crisis.
When we were younger, veterinary care was a stretch for us. And still, we had animals and still we got more pets. And I would worry about, okay, what happens if there's going to be an emergency or if there's going to be something that might prevent me from being able to take care of them like I should. And so it's nice now to be at a point where we can help others.
To be honest, when I first started, I thought that I wanted to do it just to help the animals. And I feel like in the past recent years, like the vaccine clinic especially has helped me put that together in my mind that like the community is a huge part of just like, I can't just help the animals, you have to help the people too. And that's just been like a lot. Like seeing how happy these people are and how grateful they are and just they feel like they're able to provide, whereas before I think they felt guilty that they weren't able to do these things. And now we're able to be there for them, and to just helping them means so much to me.
We know what it looks like when we don't have this kind of program. So it's not even something that we have to imagine because we've lived it. We have seen the increased number of animals coming in with preventable illnesses. We have seen people struggling and anxious, worrying about how they're going to provide for themselves and for their pets. And we've seen people surrender their pets because they couldn't afford to get them the care that they knew that their pets deserved.
They're part of the family and they are there for you. We have to be there for them. And if we can also improve that by helping the community, then that makes me happy.